Turmeric, known for its vibrant yellow color, is a popular spice that has been used for centuries in traditional medicine and cooking. It contains a compound called curcumin, which is believed to have anti-inflammatory and antioxidant properties. While turmeric is generally considered safe for most people when consumed in moderation as part of a healthy diet, there are certain individuals who may need to exercise caution or avoid it altogether. Understanding who should avoid turmeric is important for promoting health and preventing potential adverse effects. Let's break it down for some groups of people who should be cautious. Turmeric is a flowering plant belonging to the ginger family, Zingiberaceae. It is native to the Indian subcontinent and Southeast Asia, where it has been cultivated for thousands of years. Turmeric cultivation spread to other parts of Asia, including China, and eventually to East Africa and the Caribbean. The plant is well known for its rhizomes, which are underground stems that, when processed, yield the bright yellow-orange spice commonly used in cooking and traditional medicine. Traditional uses. Turmeric is used as culinary, and it's a key ingredient in many South Asian and Southeast Asian cuisines. It is widely used in curries, stews, and various spice blends. The spice imparts a warm, slightly bitter taste and a vibrant yellow color to dishes. Medicinal uses in Ayurveda. In traditional Ayurvedic medicine, which originated in ancient India, turmeric has been used for its medicinal properties. It is considered a natural remedy for various ailments. Turmeric contains curcumin, a compound with anti-inflammatory and antioxidant properties, making it valuable in traditional healing practices. Anti-inflammatory agent. Turmeric has been used traditionally to alleviate inflammation and pain. It is often applied topically as a paste to wounds and injuries to aid in the healing process. Digestive aid. Turmeric is believed to have digestive benefits and has been used to alleviate digestive issues. It is sometimes consumed as tea or added to food for its potential gastrointestinal benefits. Skin care. Turmeric has been used in traditional beauty practices. It is a common ingredient in skin care preparations, believed to promote healthy skin and reduce various skin issues. Curcumin is the primary active ingredient in turmeric, responsible for its vibrant yellow color. It is a polyphenol, a type of compound with antioxidant properties, and is believed to be the main source of turmeric's potential health benefits. While turmeric contains other bioactive compounds, such as turmeric essential oils, curcumin is the most studied and recognized for its various therapeutic properties. Here are some of the potential health benefits associated with curcumin: anti-inflammatory properties, antioxidant effects, anti-cancer properties, neuro and cardioprotective effects, anti-arthritic properties, antibacterial and antiviral properties, and last but not least, antidepressant effects. First up, we have those who are suffering from gallbladder issues. While turmeric is known for its numerous health benefits, if you have gallbladder issues, it's important to be cautious about your diet and the foods you consume. Turmeric, a spice known for its anti-inflammatory and antioxidant properties, is generally considered safe for most people in moderation. However, for individuals with gallbladder issues, it's essential to be aware of certain considerations. Stimulation of gallbladder contractions. Turmeric contains a compound called curcumin, which may stimulate the gallbladder to contract. For individuals with gallbladder issues, especially those with gallstones or a history of gallbladder problems, excessive gallbladder contractions can potentially exacerbate symptoms such as pain, nausea, or digestive discomfort. Bile production. While bile is essential for digesting fats, individuals with gallbladder issues, such as gallstones or inflammation, may be sensitive to changes in bile production. Turmeric may increase bile production. Too much can be problematic for individuals with gallbladder issues, as it may lead to discomfort or pain. If you fall into this category, worry not. There are plenty of other foods out there that provide similar health benefits, like fresh fruits and veggies, which can aid in detoxification and offer essential vitamins and minerals. Next, individuals who are lactose intolerant should also be cautious with turmeric. While not a common food pairing, some people might be sensitive to the combination, leading to digestive discomfort. If you're lactose intolerant, you can experiment with other delicious herbs and seasonings to add flavor to your meals, like ginger, garlic, or cumin, all fantastic choices. Turmeric contains oxalates, compounds that can contribute to the formation of kidney stones in susceptible individuals. Oxalates are naturally occurring substances found in many foods, and when they bind with calcium in the urine, they can form crystals that may lead to the development of kidney stones. If you have a history of kidney stones or are at an increased risk of developing them, you may want to be cautious with your turmeric intake. Now, here's one for all the fitness enthusiasts out there. If you're taking blood-thinning medication or have an upcoming surgery, it's advisable to avoid excessive turmeric consumption. Individuals with bleeding disorders, such as hemophilia or those taking blood-thinning medications, should exercise caution when considering the use of turmeric or curcumin supplements. Turmeric contains curcumin, a compound that may have anticoagulant or blood-thinning properties. Here are some considerations for individuals with bleeding disorders. Increased risk of bleeding. Turmeric may have antiplatelet effects, which means it can interfere with the normal blood clotting process. For individuals with bleeding disorders or those taking anticoagulant medications, this could potentially increase the risk of bleeding. Interaction with medications. Turmeric can interact with medications that affect blood clotting. If you are taking blood-thinning medications, anticoagulants, or antiplatelet drugs, such as warfarin, aspirin, clopidogrel, or others, combining them with turmeric may increase the risk of bleeding. It's crucial to strike a balance between natural remedies and pharmaceutical treatments. Always consult with your healthcare professional to ensure you have the best plan in place for your unique circumstances and avoid potential complications. Pregnant women should moderate turmeric intake. Pregnant and breastfeeding women are often advised to exercise caution when it comes to using turmeric, primarily due to the following reasons. Uterine stimulation. Turmeric, and specifically its active compound curcumin, has been traditionally associated with uterine stimulation. In some cultures, it has been historically used to induce menstruation, raising concerns about its potential impact on the uterus during pregnancy. Uterine contractions could pose a risk, particularly in the early stages of pregnancy when maintaining a stable uterine environment is crucial. Blood-thinning properties. Curcumin has natural blood-thinning properties. While this property can be beneficial for cardiovascular health in certain contexts, it raises concerns during pregnancy. Excessive bleeding can be a risk during labor and delivery, and turmeric's blood-thinning effects may contribute to this risk. Hormonal effects. Some animal studies suggest that curcumin may have hormonal effects. During pregnancy, hormonal balance is critical for the proper development of the fetus. The potential impact of curcumin on hormonal regulation is a consideration when assessing its safety during pregnancy. Consult your obstetrician for personalized advice. There is a lack of comprehensive studies on the safety of turmeric and curcumin during breastfeeding. While small amounts of turmeric used in cooking are generally considered safe, the potential effects of higher doses or turmeric supplements on breastfeeding infants are not well understood. The transfer of curcumin into breast milk and its impact on the nursing baby remain areas where more research is needed. And lastly, individuals with stomach ulcers or an inclination towards acid reflux should exercise caution when it comes to turmeric. Turmeric contains compounds that could potentially irritate the stomach lining, especially in high concentrations like those found in supplements. While using turmeric as a spice in cooking is generally considered safe, taking turmeric supplements may pose risks for those with existing stomach ulcers. In the case of acid reflux, turmeric, particularly its active compound curcumin, may relax the lower esophageal sphincter, potentially allowing stomach acid to flow into the esophagus and exacerbate symptoms. Individuals with acid reflux should monitor how their bodies respond to turmeric and be aware of any worsening of symptoms. Remember, friends, everyone is different, and what works for one person may not work for another. If you're unsure about incorporating turmeric into your diet, always consult with a healthcare professional. And that's a wrap, my friends. Thanks for joining me on this educational journey about turmeric. Remember, health is wealth and knowledge is key. If you found this video helpful, don't forget to like, comment, and subscribe. Until next time, stay healthy, stay happy.